Thanks very much, and hello everybody, and welcome to today's seminar, Working in Partnership with LGBTQIA+ communities. So very briefly, my name is Danielle Mackle. I am a lecturer in social work at Queen's University in Belfast, and I'm here with my colleagues Amanda McGurk and Leo Lardy, who are from Here and I and the Rainbow Project. So today we're going to run through a really hopefully very interesting and engaging session. Today I will start by setting the scene. I'm going to take you through some slides. Then I'm going to hand over to Amanda and Leo, who are going to talk us through some of the more salient and interesting points I think that link to this presentation. And then at the end, we will have a question and answer session. So as Alison has said, if there's anything that's coming up throughout the presentation, if you could put your questions into the chat and then we can address them at the Q&A section after the speakers have presented. So for me, I think I just really wanted to set the scene and think about some of the statistics that are out there in the research arena in relation to some of the complexities that our LGBTQ+ populations are living with. So for example, there was a national LGBT survey conducted in 2018, and there were over 108,000 participants who identified as LGBT who responded to this survey. And I just want to pick out a few of these points because I know Amanda and Leo are going to address the Northern Ireland context. But when we think about this particular population, I thought it was really interesting that 68% of those 108,000 people in 2018 had stated that they avoid holding hands in public with their same-sex partner for fear of a negative reaction from others. And so that still remains today, and that's quite a concern that people don't feel free to be out in public still throughout the UK and indeed in Northern Ireland. Some of the other interesting statistics include the fact that over half of these participants stated that they're not out at work. And I just wanted to take a moment to reflect on that and think about how difficult that must be to have to mask who you are at work and not be able to have those, break room conversations about what you did at the weekend, or trying to hide the fact that you may have a same-sex partner. And hiding part of yourself can be a very difficult thing to do, and particularly when you're spending around 40 hours of your week in work. Again, in terms of people then not being out at home, almost or over a quarter of those participants of those 108,000 had stated that they're not out to family members either, and those people who they live with. And again, just thinking about that, how difficult that must be to have to hide part of who you are from the people that you know and live with. Another couple of interesting points then, and this really specifically links to our profession as social workers. 46% of those 108,000 participants had stated that they have never discussed their LGBTQ identity with health and social care staff that they've been involved with within the last 12 months preceding the survey. And I thought that was a really salient and important point to think about in terms of what we as a profession are doing and why there's a barrier there to people outing themselves to the people that they're working with. And finally, 68% of the trans participants of the survey had stated that the waiting lists for gender identity services are too long. And I think Leo may address some of these points in his presentation, but I think that's a really important point to remember, and that has only gotten worse as a result of COVID. So I think Leo will touch on some of that later on. Just very briefly, my research interests do link to the LGBTQ+ population, and some of the points that I have been interested in and looking at, and I know Amanda will address mental health, but it's important to remember that mental health problems can be more prevalent among LGBTQ+ communities due to the experiences of ongoing discrimination. When we think about the people that we work with, so older people then are more likely to have experienced longer exposure to discrimination and hostility, including living through discriminatory laws. When we think about our young people, we also need to remember that the research is telling us that young people are at a greater risk of going into care or experiencing homelessness than their peers due to these negative reactions from our families and communities. And finally, almost half of LGBTQ+ young people have experienced or are experiencing bullying at schools. And these experiences can result in greater levels of mental ill health, substance misuse, and sexual health issues for LGBTQ+ people than that of their heterosexual peers. I think when we're thinking about then social work, I always think it's important then to link it back to some of the practice considerations that we need to take into context. So when we think about our assessments, We often in our assessments give consideration to the support that our families and extended families can give a person. And so when we think about LGBTQ plus populations who potentially are more likely than others to face challenges with their family, so it's important for social workers to remember that, you know, LGBTQ plus people may seek support from a chosen family, so those friends who've become like family as a result of the challenges they've maybe faced with their own family. So it's important that we're taking that into consideration within our own assessments and when working with somebody who has chosen to out themselves to us as LGBTQ plus. And also, and I've witnessed this in practice myself, you know, social workers may be uncertain about how to approach conversations surrounding sexual orientation or gender identity, potentially because they see these questions as private and not appropriate for discussion during assessment. But I've really highlighted in bold this very salient and, you know, important point. How can a person's need be assessed holistically if they're LGBT and the social worker does not know this? Okay, so you may think it's a difficult or awkward conversation to have, but I can't emphasize enough how important it is that we have the confidence to ask somebody how they identify, okay, because we cannot assess holistically if we don't know. So thinking about how we can create an inclusive environment from a social work perspective, and you know, lots of services already do this. So I just think it's important to mention, you know, if people are asking or curious as to how we can be more inclusive as a profession, it's important to listen to how people describe their identity. What pronouns are they using? How are they describing their relationships? And so that we can reflect that back and use that language with the people that we're working with. It can often be important to display LGBTQ plus inclusive literature in waiting areas. And again, I'm here with my colleagues from Here NI and the Rainbow Project. And so if there are leaflets that we can be using from these organisations, it's always helpful to have those on display. Perhaps we could use visible signs like having a rainbow or pride lanyard, or using pronouns on our name tags like I've done in my screen, or on our email tags as well. And I think it's always important to have training for all staff about LGBT identities and policy expectations. And like I've said, I'm here with colleagues from the LGBTQ plus sector, Here and the Rainbow Project, who do provide and can provide LGBTQ plus awareness training for staff. So without further ado, I'm going to hand over to my colleague Amanda from who works across Here and the Rainbow Project. And Amanda's going to talk to us in more depth then about some of the complexities of working in Northern Ireland.
Thank you very much, Danielle. As Danielle has stated, my name is Amanda McGurk. I am a mental health advocate in both the Rainbow Project and Here and my pronouns are she, her. Obviously, we've been given approximately 20 minutes each to speak today, and I have looked at what I'm going to talk about and could probably talk for about 20 hours. I'm not going to do that to you. I'm going to give you a brief overview of the inequalities faced by the LGBTQ plus community as a whole. Some of these points are going to be on coming out that Danielle has previously mentioned. Heteronormativity, mental health, drug use, barriers to access and support, domestic abuse, the underreporting of domestic abuse, intersectionality, age and population, isolation, and then how can you make a difference? So I'm going to go through this as quickly as I possibly can, because I know if I go over, Leo's going to have trouble with me in the office later. So coming out's the first thing. People ask me all the time, Amanda, what's your coming out story? I'm like, which one? Like, what do you mean? I come out nearly every day. Every time I go into a session like this, go into training, go out and about and tell people about my work, I come out, I disclose that my sexual orientation is something other than heterosexual. It's a very individual thing, and people do it in different ways. Some people struggle with coming out, and you have to allow them the time and the space to be able to do that when they feel that they can do so. Also, if somebody comes out or discloses their sexual orientation or gender identity to you, that is not for you to discuss around the office or to tell other people unless that person has specifically given you permission to do so. Coming out is, as I say, very personal, and to out somebody is very badly frowned upon within our community. Heteronormativity is where the assumption that heterosexual relationships is the default, and therefore when you meet someone and they are female and they talk about their partner, it is automatically assumed that their partner will be male and vice versa. This assumption makes it very difficult for LGBTQ plus people, who then have to feel as if they may have to out themselves, and it makes our community more invisible and further marginalised. Mental health is a massive issue right across the Northern Ireland, or the north of Ireland. In a systematic review programme of the mental health statistics in Northern Ireland in 2021, it was reported that here in this small place we live in, we have the highest prevalence of mental health problems within the UK. Now, to put that into context, we're a wee tiny part of an island, and you have the likes of England, Scotland and Wales, where they have a lower prevalence of poor mental health than we do. Within that, 84% of those surveyed in the Rainbow Project State of the Community in 2021 survey stated that they have issues in daily life or work due to depression and anxiety, or are sad. So that's 84% of those who were asked in a survey in 2021 in Northern Ireland said that they suffer from depression and or anxiety. We also have a higher prevalence of suicide and suicidal ideation among minority sexual orientations. Suicide ideation or suicidal thoughts. And
His dog.
Can whoever has the dog in the background please mute themselves?
Sorry, I was late and I couldn't get connected. Yes.
That's absolutely fine. I'd rather get interrupted by a dog than somebody else. So yeah, I'll continue on. So yes, suicide and suicidal ideation is of a higher prevalence within the LGBTQ plus community, also compared to the rest of society. Drug use is also an issue for our LGBTQ plus society within Northern Ireland, and 58% of LGBTQIA plus people stated that they've used drugs other than for medical use. 29% use more than one drug at the same time. 60.75% have used cannabis in their lifetime. Almost 50%, so 49.31%, have taken antidepressants at one time in their life. Other than the above, the most used drug within the LGBT sector within Northern Ireland was poppers at 46.11%. One of the reasons that has been suggested for this high prevalence of drug use is minority stress, discrimination, homophobia, biphobia and transphobia. And this includes internalised homophobia, where the LGBTQ plus person also feels that to some degree their sexual orientation or gender identity is wrong, and this is caused by the discrimination they face their whole lives, being told their whole lives that being gay, bi, trans is wrong. Other barriers to access and support, we have unequal healthcare. I'm sure Leo is going to go in to a lot more detail about the unequal healthcare for trans people. A fear of being outed or having to out yourself. So if you go to access support somewhere that is not an LGBT organisation, you may have to disclose your sexual orientation and your gender identity. And I'm not saying by any stretch of the imagination that other organisations are homophobic, biphobic or transphobic, but there's a perceived fear there because you never know how someone is going to react, pardon me, when you come out. a fear of being pressured into services to change your sexual orientation or gender identity, so conversion therapy, or to be offered that alone is so detrimental to someone's mental health. For other organisations, limited knowledge of LGBTQIA specific care. I have had women come to me in the past and say, I went to access help for whatever the issue was in a mainstream organisation, and I was told, I actually don't know what to do with you because you're a lesbian. When we think about things like this and we realise that that woman's never going to go anywhere else and ask for help because she's been told, I don't know what to do with you. Limited or no LGBTQIA specific mental health assistance. For me and my colleague Amy, who both are mental health advocates within the LGBT sector, we only started our post in April. It's a 2-year post. We're hoping to get refunded. However, before we came in to post, there was nobody doing the work that we do. And if we don't get refunded, the posts and the support will be lost. So having specific mental health assistance is really valuable. There are very few safe spaces for LGBTQIA plus people within Northern Ireland that don't involve alcohol. So if you go to the LGBT centre, you're not allowed alcohol, but the majority of places for people to meet other LGBTQ plus people are gay bars. Kremlin, Maverick, Libertine. So that probably brings on the alcohol narrative. And then around alcohol and drugs, where the support services for specialist alcohol and drug dependency, they're all on a heteronormative basis. Again, within domestic abuse, the invisibility of organisations that support LGBTQIA victims and survivors. So we encourage organisations to have, some sign that they are LGBTQ plus inclusive. Lack of knowledge within our own sector for people who are experiencing domestic abuse. Do they recognise that domestic abuse happens between 2 men or 2 women, or people who are not inherently heterosexual? Lack of services within the LGBTQ plus community. We did have a domestic abuse worker for LGBTQIA women and girls at risk of or experiencing domestic abuse. However, the funding was ran out on that project and it was never refunded, so that worker has now gone along with the expertise. Lack of funding. We have so many really, really brilliant projects. We get funded for 2 or 3 years from a grant making organisation who want to do so, and then trying to refund is a very, very difficult thing to do, such as the domestic abuse post. Within domestic abuse, many people from the LGBTQI community have mistrusted the police service, so they won't disclose that they have experienced domestic abuse. There's also a fear of harassment, victimisations, such as homophobia, biphobia, transphobia from the police. I am not saying in any way, shape or form that PSNI is homophobic, biphobic or transphobic, but there have been occasions where this has happened within the police service, and we always hear about the one bad experience somebody has. Fear of having to out yourself, so having to disclose that you are being abused is a tough enough thing to deal with without then having the added pressures of having to out yourself to get support. And whenever we see advertisements and campaigns around domestic abuse, the norm is to have a heterosexual couple, a man hitting a woman. Now, for anybody who knows anything about domestic abuse, the hitting part is very, very small amount of domestic abuse, and for many and the largest majority of people who do experience domestic abuse, it is a female victim and a male perpetrator, but that is not the only way and form of domestic abuse. On to intersectionality. Many people in our community are faced with the result of being caught in a negative cycle of marginalisation. It is acknowledged that the LGBTQIA community are diverse with multiple identities and differing needs through their life cycle within our community. There is further marginalisation, discrimination and isolation. There's often failure to recognise that there are multiple identities within LGBTQIA people. For example, LGBTQIA people plus who are also with a BAME background or disabled could find themselves at further disadvantage because we don't have the expertise right across the board. We're also facing an ageing population where older LGBTQIA plus people have a significantly greater dependence on professional care services. They're twice as likely to be single. They're 2.5 times more likely to live alone and 4.5 times likely to have no children to call upon in times of need. 1 in 5 older LGBTQ plus people have no one to contact in times of crisis. A further concern for our community is residential care. There's a lack of information around residential care for LGBTQIA plus people, and there's no dedicated residential care provision for people in Northern Ireland. So if you go into residential care as an older LGBTQ plus person, quite often they go back into the closet and hide who they are and do not disclose their sexual orientation or gender identity. How can you make a difference? You can create an LGBT inclusive workplace with literature, materials and gender neutral language and affirming language, like Danielle said. Have flyers about from the Rainbow Project or Here and I. Don't assume somebody's gender identity or sexual orientation when you meet them. If you are unsure of the pronouns, you can just ask. It's one of the easiest things to do. All you have to do is say, hello, my name is Amanda, my pronouns are she, her, and they will reply with their name and their pronouns. Monitor sexual orientation and gender identity in both employment and service use. Do a policy review to ensure that your language is all inclusive and instead of she and he, use they and them. Creating ways for LGBTQ plus employees and service users to be heard and shape policy and practice. To access training and support. As Danielle alluded to earlier on, both the Rainbow Project and Here and I deliver sexual orientation and gender identity training. Leo also does trans and non-binary training, and you can get ongoing support from the Rainbow Project and Here and I. I hope that I didn't go too far over the 20 minutes, and I'm going to pass over to Leo.
Thanks, Amanda.
Yeah, ready? Should I just go? Go for it.
Yes, absolutely.
Hello, everyone. Oh, there I am. Hello, everyone. My name is Leo Lardy. My pronouns are he, him, his. I am the Sexual Health Development Officer at Rainbow Project, but I'm here today to talk about trans and non-binary people's experiences in Northern Ireland. I myself am a transgender man. That means that I was assigned female at birth and realized much later on that actually, no, I am a man. I have transitioned. I have accessed hormone replacement therapy. I've socially transitioned. I've changed my name. I've changed my pronouns. And I have had top surgery as well. So I have transitioned. And today I'm just here to give you a really brief outline of some of the issues that are faced by the trans and non-binary community. If you're not aware already, something that a lot of trans and non-binary people experience, but not everyone, would be dysphoria. Dysphoria is a real strong sense of discomfort, of apprehension, of tension, even disgust at when your body doesn't match expectations of what is typical for your gender identity. And those expectations can be those of other people or those of expectations that you have for yourself. So for instance, boys do not have breasts. Women do not have deep voices. Women have certain shaped faces. Men are a certain height. And that kind of feeling that your body doesn't match how you feel can cause this real kind of upset in yourself. Not every single trans and non-binary person experiences dysphoria. In fact, many of us don't. but quite a lot of us do. And the unfortunate thing about dysphoria is it's very difficult to resolve. It really cannot be counseled away, mindfulness away, yoga away, medicated away. Really, the only way to alleviate dysphoria is some form of transition, and that can be different for different people. So there's social transition, that's changing names, changing pronouns, maybe changing how you wear, what you wear, or how you present yourself. There is hormonal transition, that is going through either hormone replacement therapy like testosterone, estrogen, to essentially kickstart the puberty that your body missed, and that gives you the kind of the appearances that maybe is more typical of your gender identity. So me on testosterone, that meant that I was able to grow a beard, that I have a lot more body hair now, that my fat has redistributed, so I'm a little less curvy and a bit more straight up and down, and it also cracked and deepened my voice. And it works differently for different people. Some people experience a lot of changes, some people not so much. And there's also surgical transition. We don't call this the surgery because there's actually several surgeries a trans or non-binary person can elect to have. Everything from top surgeries, removing breast tissue, creating breast tissue, lower surgeries, creating a penis, creating a vagina, whether that's for penetration, oral, stroking, just aesthetic. And also surgeries like facial augmentation surgery, which can change the shape of the face, and also vocal cord shaving, which can help people who are trans women or trans feminine reach a higher pitch and register in their voice that they maybe can't reach with vocal training. Dysphoria is one of the most difficult things about being trans, and really the only way to alleviate or resolve it in any way is to access some form of transition. Social transition can often be done without any kind of outside help or input. You don't need to go through any kind of special assessment or procedure to change your name, to change the pronouns you use, or to change how you dress. And for a lot of people, social transition can give them a lot of comfort and confidence in themselves. But for many trans and non-binary people, they are going to want to elect some kind of hormonal or surgical transition as well. And the issue is here that we have incredibly long wait lists to access the Gender Identity Clinic. The Gender Identity Clinic is in Knockbrackenburn, and it is our only gender identity clinic in Northern Ireland. At the moment, there are 500 people on the wait list to get access to that clinic. And the waitlist currently is sitting at 5 years. That's not 5 years to get into the clinic and to immediately get on hormones and to immediately get surgery. That's 5 years to start the process. So if you wait 5 years, you get to the clinic, and generally what happens is there will be a 2-year prolonged psychiatric assessment. And if I'm being kind, I would say that that assessment is really intensive and difficult. If I was being unkind and possibly quite true, I would say that sometimes that assessment in some cases can breach human rights. And it is very pathologizing, it is very degrading, and it is very confusing. Because we are having to prove to someone who is not transgender that we are who we say we are. And if you can imagine trying to prove that you are gay, or to prove that you're a lesbian by how well you fit into those stereotypes of what a gay man or a lesbian is, you can imagine that many people in our community would not be able to prove that they were gay or lesbian because they were not falling into the stereotypes. That's what it's like for a lot of us trans people. I am a trans man, and I had a lot of difficulty accessing the Gender Identity Clinic. I was told on several occasions that I was too empathetic to be a man, that I was too kind to be a man, that I was too comfortable with femininity to be a man. And I don't know about you, but I think I look like and act like every other bloke out there, and it's quite upsetting to me, the idea that men are not kind and empathetic. That's not good news for the rest of us, is it? And that is an incredibly difficult process because we often find that even those of us who are going in with our best foot forward and the intention to engage in it in an honest and genuine way, we find that any kind of doubt or concern or difference amongst us makes our transition much more difficult and much more prolonged. I find that some things that I said in the first 3 sessions I had at the Gender Identity Clinic were being used against me 2 to 3 years later as I waited for top surgery. How people treat you as a trans person depends solely on how well you pass. Passing is this idea that you can be seen as someone who is a cisgender man or a cisgender woman. So me, I pass. If I go into the boys' toilet, no one bats an eyelid. If I get a taxi and I say, "Is this taxi for Leo?" the taxi driver will say, "Yes, this is absolutely, come on in." However, when I hadn't been able to hormone transition or surgically transition, my life was impeded by other people's expectations of what I should be like. So I would be denied access to certain places because of how I look. People would assume that there had been a mistake made when I would show up at an appointment for a Leo. You'd be like, "That's obviously not you, that's the boy's name." Yes, that's kind of the point. And how people treat you as valid really depends on how you look as well. Being trans really has nothing to do with how well you might pass as a cisgender man or a cisgender woman. And so many of us have no interest in doing that. But the truth is that our lives are so much easier when we do. And what's so frustrating about being a trans person and having that, like, people treating you kindly and with respect and with dignity, coming with the ability to transition, is that for many of us, we are talking 5 to 10 years to be able to access those things that would help us sort of blend in with the rest of society. It's not so difficult for people who are trans men like me. Even before people would have assumed that I was male, life was still pretty easy for me. You know, as someone that people assume to be a woman, if they saw me with short hair, and wearing jeans and a t-shirt, very few people would bat an eyelid at me. It's very common for women to wear jeans and to have short hair. However, for my friends who are trans women or who are trans feminine, there is hell to pay. We are not very comfortable in society when we see someone we presume to be male wearing a dress, wearing makeup, having long hair. It opens the door to a lot of discrimination and a lot of hate crime, whether people immediately recognize the fact that you are trans or they assume that you are an effeminate gay man. I have a really hard time being out in public with some of my trans girlfriends because the amount of abuse and hatred that they get on the street is just sickening to me. And what's so frustrating is that that would be a lot easier if they could get some form of transition, but they're not able to because they're held up by this incredibly long psychiatric assessment. Most people in Northern Ireland to get access to hormones and surgery in a timely manner have to pay privately for that. Private is incredibly, incredibly expensive. We are talking £195 just to access the service, £30 a month subscription fee, and up to £100 to £1,000 per month for your medication. Now, these prices would go down considerably if a GP would accept shared care, but the reality is there are maybe less than 5 GPs I know of in Northern Ireland who will accept that. They do not recognize that the private healthcare who are overseeing that care are involved enough in the care and that they need them to go through the GIC. So it means that a lot of trans people are literally below the poverty line, attempting to pay for medication that is vital, not just for them to not receive discrimination, hate crime, and harassment, but for their own mental health and well-being. It's really quite devastating for me as a trans person. I've lost a lot of friends on that wait list. I've lost a lot of friends on that wait list. And it's really hard for me to be, like 7 years down the line of doing this and nothing has changed. In fact, honestly, things have gotten worse. One of the most difficult things about being a trans and non-binary person, especially in the UK, is that we are seeing an increasingly hostile environment towards trans and non-binary people. Trans and non-binary people, I think we make up like 1% of the population, like 1 in 1,000 people are trans or non-binary. And yet you would think that we were responsible for every single ill thing that happens in this world. I think there was something like 1,000 transphobic or anti-trans pieces in the media per month last year. I cannot open my phone in the morning without seeing a news article about why people like me are pedophiles, why people like me shouldn't be allowed in gyms, why people like me shouldn't be able to be in sports, why people like me shouldn't be teachers. And the list goes on and on and on and on. And I am someone who is incredibly lucky. I am supported and loved by my friends, my family, and my chosen family, and of course my workplace. I would consider myself really well set up. And I'll tell you that some days it's really difficult for me to want to keep on trucking because it just is so depressing. And I imagine what that might be like if you were a 14-year-old who hasn't been able to come out as trans, who is overhearing these debates about why people like you are dangerous and sick and society needs to be protected by you. I can't imagine what it would be like to have to hold that into yourself and then also just every time you open the internet, there's some reason as to why you're awful. And a lot of the debates around trans issues are just completely misguided and misinformed. A lot of debate at the moment is about the gender recognition certificate. This is a certificate that changes the gender marker on your birth certificate from M to F or F to M. You do not need a gender recognition certificate to be a trans person in the UK or Northern Ireland. Essentially, all it does is changes the fact that you will be recognized as your true gender when you get married and when you die. And that is all that changes. You don't need a gender recognition certificate to go to a women's gym if you're a trans woman. I don't need a gender recognition certificate to go into the boys' toilet. Same way you don't need to bring your birth certificate when you go to those places. But you would be forgiven for thinking that a GRC means that trans people are able to infiltrate and harass and abuse women everywhere. What is really fascinating to me is that this is not new. In fact, all of these arguments against trans people currently are just recycled homophobia. Hopefully there's some people, some goldies in the chat who remember the 80s and the 90s, who remember seeing articles in the newspaper about gay teachers. How dare they teach your children? What kind of ideology are they spreading? Some of us might remember Section 28 when gay people were not allowed to be mentioned in primary or secondary education, leaving an entire generation lost without help facing homophobia alone. And of course, those teachers and professionals unable to come out in the workplace. So this is not new stuff. This is just recycled hate, but it's being directed at trans people. And I would like to point out that it's really bizarre to me that when we are talking about trans people and the GRC being abused or trans rights being abused, we're not talking about bad trans people. We're talking about people pretending to be trans. And let me tell you, it is incredibly complicated to transition in the UK and Northern Ireland. And even if it was easy, it is not something that someone would likely abuse just to get access to a women's toilet. If a man wants to go into a women's toilet, he can do that. Do you understand what I'm saying? There's nothing stopping him doing that. All we're doing when we are safeguarding women from trans people is making trans women more vulnerable. And what I see a lot of recently is these kind of anti-trans ideas and laws really starting to affect cisgender women. So cisgender, if you're not aware, it means not trans. Cisgender means you identify with the gender you were assigned with at birth. So I have seen cisgender women, maybe lesbian cisgender women, maybe women who are slightly more masculine, who have short hair, who maybe don't have a prominent chest, being kicked out of women's gyms, being kicked out of women's bathrooms for not being real women. We've seen it in sport even, women being forced to undergo blood testing, chromosome testing to prove that they are women, and they are. So what I think is really interesting is that kind of trans hate is actually blowing back on women everywhere, not just trans people. And I'm very concerned as well, especially about trans kids. Puberty blockers have been talked a lot about recently. They are not unsafe to use. They are completely reversible. They do not force someone to transition. Puberty blockers just stop puberty. They're meant to be there to allow a young person time and space to breathe before going through puberty, which for a trans person going through the wrong puberty can be a mental health crisis. It can literally cause them to try and take their own life, and it can cause irreparable damage to their mental health long term. Puberty blockers are meant to give young people a chance to figure out who they are, what they want. Are they trans? Do they want to transition? Are they just uncomfortable with certain aspects of their body? Is something else going on for them? And we are taking that away from them. And what I think is really interesting about all these debates about trans people is that the medication that trans and non-binary people use is available to cisgender people, and we have no issue with it. We use puberty blockers on cisgender children frequently for precocious puberty. We never hear about that being unsafe or risky. But when it comes to trans people, suddenly we have to go through a million miles of red tape just to get something that you take for granted every day. I would just want to say that, trans people, because of how the gender identity clinic is so overwhelmed and oversubscribed right now, do not expect a trans person to look like a cisgender man or woman. Remember how difficult it is to access transition, and also keep in mind, especially for trans women, I know a lot of out, proud, and happy trans women who over the last couple of years have slowly started to act less feminine, who have cut their hair short, who won't wear dresses or skirts or heels or tights or stockings in public, because that makes them visible as a trans person, and that makes them visible for hate crime and harassment. So when someone comes to you and they say, I'm a trans woman, and you think, well, you don't have long hair, you're not wearing makeup, you're not wearing a dress, I think you're lying, maybe you're confused about it. Keep in mind, A, that person has not been able to access transition yet, and B, why would you go, it's a very brave and bold thing to dress accurately to how you feel in the face of such aggressive violence and harassment. Would you make those same decisions if you were in that space? Hate crime against trans and non-binary people in Northern Ireland shot up by like 300% in the last year. There are times I genuinely fear for my life and the life of my friends. It is just so easy to be kind and respectful to trans people. All you need to do is to listen and to ask questions when needed. One of the most important things I say to you is, I think it's very cool what Danielle said. It's important to just ask questions, but there are some things you shouldn't ask, and I'm just going to put them out there so you know forever. When you're talking to a trans person, unless it's absolutely medically relevant, unless it's absolutely relevant, you really do not need to know anything about their genitalia, anything about how they have sex, and anything about their surgeries. I have been at mental health assessments, and within seconds, the clinician has asked me, how do I have sex? Not, am I comfortable with my sex life? Am I happy with my sex? How do you and your boyfriend have sex? Bit concerning. I'm pretty certain there's only a couple of ways you can do it. But can you imagine how devastating that was for me in one of my weakest and most vulnerable moments, to be treated like a circus sideshow, when all I wanted was to be treated like somebody else? If it's medically relevant, go for it, but it's just not necessary. Trans and non-binary people aren't there to answer all your little interesting questions and queries. Google exists, YouTube exists, people like the Rainbow Project exist. Call us, ask your weird questions to us. We're happy to answer at any time. But just remember, a trans or non-binary person is a human being who deserves respect, kindness, and empathy that I know you're all so capable of doing. And don't be so afraid of making mistakes. Trans and non-binary people are very understanding that mistakes are going to happen. And we can tell when someone's made a genuine error and when someone's trying to be hateful. So please don't feel like you have to pull yourself away from us for fear of doing the wrong thing and getting cancelled. Because for a trans and non-binary person, if you pull away from us, we don't know whether that's because you're nervous or because you hate us. And that can make it very difficult for us to engage with your service. So if you're feeling awkward, you can say, like, let me know if I've said anything wrong, or please keep me right here. I want to make sure you're happy and you're comfortable and I'm doing the right thing. Or did you say use he, him pronouns? Great, mine are she, her. It's just about asking questions and sharing. And remember, they're just normal people like everybody else. And I will set up because I don't want to go over time. And I want to leave time for questions.
Thank you so much, Leo and Amanda. Both those talks were honestly amazing and inspirational, and so many other emotions that I felt as you spoke there, both of you.